you see the patient's info, and you see an indicator for apneas. In the analysis, there's an AHI, a total sleep time. What do you think is this report? So this is a sleep study result. However, it's not a comprehensive sleep study. This is a home sleep test result. So typically, home sleep test results, the ones that are flow-based, what are the flow-based HST studies? You have your Apnea Link, you have your Somfit Pro, you have your Night One from Philips. All of these home sleep testing devices are small, but they also have a cannula to monitor their flow pattern or even a thermistor so that the doctor is able to see if they stop breathing or not. But this is a home sleep testing device report. And you know that for a fact because usually they won't have all the other parameters, particularly the like leg movement, periodic limb movements. Arrhythmias they can show, but not all home sleep testing are cleared yet for arrhythmias. But you can see their pulse, you can see their flow pattern, you can see their snoring, and some can identify central versus obstructive sleep apnea. So the report for home sleep testing is minimal. However, it's not going to be like that for too long because the newer devices, the newer home sleep testing devices, are now able to identify sleep stages. So you will see now N1, N2, N3 RAM, or they can justify whether it's RAM versus non-RAM. So they can also then identify arousals because if you can identify EEG pattern, you are able to identify arousals. Now, what are we looking at here?
Central sleep apnea.
Respiratory events.
Central apnea. Very good. What else? Crescendo decrescendo pattern, which is what? This is a Cheyne-Stokes pattern, and this is definitely a central apnea. What else?
An artifact.
Very good. What kind of artifact?
Ballistic.
Cardioballistic. I don't know why they term ballistic. It's not respiration. So this little pattern here usually will follow the pulse or the patient's heartbeat. So there really is no pattern. It's central apnea. But how come you see this squiggly lines? But then there's completely no effort. There's no effort. This patient is not breathing because this patient's having Cheyne-Stokes because of the crescendo going up and then decrescendo. So crescendo, decrescendo pattern followed by a flat line. So if this lasts for a few cycles, then this is a Cheyne-Stokes respiration. Very good observation. And what is the other thing that usually accompanies a Cheyne-Stokes respiration pattern?
The saturation.
The cyclical or cyclical pattern of oxygen, desaturation and saturation. So if you look at this, it goes up and down, just like a seesaw, it goes up and down pattern. It follows exactly a Cheyne-Stokes respiration pattern. This gives you another confirmation that this is in fact a Cheyne-Stokes respiration pattern because of that saturation going up and down. Looks like a sinusoidal waveform. All right, very good. Now, since you already mentioned the Cheyne-Stokes respiration, we'll skip this one. All right. And what are we looking at? This is too easy.
REM.
So this is RAM. Okay. But my next question will be, what is this? Anybody want to take a stab on what is this sleep stage? Very good. So this is tonic REM, right? Look at the chin. Very high muscle tone. So this is REM without atonia, meaning there's muscle tone. And usually when you have tonic REM, you don't have many, what is this?
Eye
Eye
movement.
movement.
Yes, you don't have many eye movements. So what is this type of REM?
Phasic.
Very good. This is phasic REM. All right. So you have phasic REM right here and then a tonic REM. So main difference is muscle tone, very little muscle tone. And so we have to remember that fact. Okay. When we talk about REM, we usually say REM. I know it's REM because there's no muscle tone, not all the time. So just to be clear, when you see eye movement and then there's no muscle tone, that's phasic REM. But if you see very little eye movement and then there's an increased muscle tone, but yet it's very quiet. See, this is all low amplitude mixed frequency. Very difficult. The only thing is that when you get used to scoring, you're going to be very sensitive in little fluctuations like this. This gives me an idea. This is REM right here. as soon as I see this pattern. But the other pattern that I look at really is the respiration. When you're scoring and you're reading a sleep study and you're not sure, especially during tonic REM, that you don't see the clear eye pattern in phase and out of phase, then I look at the respiration because the respiration will become typically erratic, right? They will have varying tidal volume, varying flow, amplitude. The signal will be big, small, very small, then big again. It's very erratic. So that's how you know that the patient is in REM. Any questions? What are we looking at?
Hypnogram.
Very good. Absolutely. So this is
S
the
kasi sir eh. SS3.
you know why? Because this is an old slide. You know how we used to call sleep stages before? It used to be stage one, stage two, stage three, and stage four. Does anybody know or remember the difference between stage three and stage four before it became N1, N2, N3, and then REM? No more stage three and stage four. So, historically speaking, we used to follow not the SM guideline, we used to follow the R and K manual.